Good morning. I'm Dr. Gonzalez. How are you doing today?
Hello, doctor. Good morning. I am doing fine. Thank you. A bit worried out, but I am here to resolve everything.
I understand. It's completely normal to feel concerned and when something doesn't feel right. I'm sure I'm here to help you. Before we get into your symptoms, I would like to ask you some few questions to complete your health history. Does that sound okay?
Yes, of course. Go ahead.
Okay, great. First, um, could you please tell me your full name, please?
Sure, my full name is Lucia Royartay.
Okay, thank you, Lucia. Where do you currently live?
I live in Mexico City in the Condesa neighborhood.
Okay, that sounds cool. Um, who do you live with at home, Lucia?
I live with my partner and our two young children. They are at school right now.
Okay, got it. Now let's move on some physical details. Could you tell me your height, please?
I am 1 meter 6'5".
Okay, great. And what is your current health weight? Sorry.
Yes, I weighed myself a few days ago. I am 68 kilograms.
Okay, perfect. Thank you for sharing that. Now I will ask you some about any allergies you might have. Is there any substance or medication that you know causes an allergic reaction on you?
Yes, I am allergic to penicillin. I get hives when I take it.
Okay, thank you for letting me know. I will make sure to note that. Now, moving on your medical history, do you have any chronic condition or disease that we should be aware of?
Yes, I have hypertension, but it's well controlled. I take medication every day to keep it stable, and I also monitor my blood pressure regularly.
Great. Thank you for the information. Now I would like to know more about the reason you find your consultation. What symptoms or issues have you been experiencing that made you to schedule this appointment?
Lately, I'll be been getting pretty severe headaches and dizziness, especially when I get up or change position quickly.
Mhm.
Also, I'll be feeling more tired than usual, even though I haven't done anything physical exhausting. I am a bit concerned about it.
I understand your concern. Headache and dizziness can be related to a variety of factors, some of which might have to do with your blood pressure or underlying causes. Since you also mentioned feeling unusually tired, this could be related to your hypertension, but it could also be due to other factors such as stress, lack of sleep, or other hormonal changes. Can you tell me, please, if there have been any changes in your habits lately? Like, for example, have you have been more stressed, having your trouble sleeping, or notice any changes in your diet?
Yes, now that you mention it, I've be under a lot of stress lately. My job has been demanding more time, and although I try to get 8 hours of sleep, sometimes I have trouble. I haven't changed much in my diet, but I'll be been skipping meals because of work.
Thank you for sharing that, Lucia. Stress and sleep problems are significant factors that can trigger the headaches or the fatigue. Also, not having a regular eating routine can affect your energy levels. I would like to know, have you been measuring your blood pressure at home recently? Have you noticed any changes in your readings?
Yes, I checked it a few days ago, and it was a bit high. Normally, my blood pressure is 120 over 8, but this time it was 140 over 90. It worried me a little.
Okay, I understand your concern. It is important to keep an eye on these changes. Your blood pressure is ele- elevate with which could be contributing to the headaches and the dizziness. However, since you mentioned that is usually well controlled with medication, it might be that the stress and the lack of sleep that affects your levels. I recommend continue with your medication as prescribed and taking a regular blood pressure readings to the monitor it. Also, it will be important to make time each day to relax. This means that maybe you can practice deep breathing or do any activity that allows you to disconnect from your stress.
What else can I do, doctor? Should I get any test done?
At this point, I don't think additional tests are necessary. However, if the symptoms persist or your blood pressure remains high, it will be a good idea to visit your primary care doctor to adjust your medication to perform additional tests like an electrocardiogram or a bloody work. Also, I suggest improving your sleep routine because make sure you're getting 7 to 8 hours of sleep each night and eating more regularly to maintain a stable energy levels throughout the day. If you can, please try to reduce the sources of stress as much as possible.
Okay, doctor. I'll follow your recommendations. I feel a bit more it easy now, but I'll stay alert to my symptoms. If anything changes or get worse, shall I contact you?
Exactly. If the headaches become more intense or frequent, if the dizziness worsens, or if your blood pressure stays high despite taking your medication. Please don't hesitate to reach out to me or visit your primary care doctor. It is important to monitor your progress closely.
I will, doctor. Thank you for your time. Guidance.
You're welcome, Lucia. I'm glad to help you. Remember, your health is a top priority. Wishing you the best and a speedy recovery. Take care, and we will stay in touch.
Thank you, doctor. Have a great day.